The American Thoracic Society, in conjunction with the European Respiratory Society, has described acceptability and repeatability standards for spirometry testing, each of which we will discuss in this unit. For each test maneuver to be deemed adequate or acceptable, certain criteria must be met. Consider the following acceptability questions after each trial. Did the patient understand the instructions? Was the start of the test satisfactory? Less than 5% or 150 milliliters, the greater of the two, back extrapolation. Was inspiration performed with maximum effort? Was there no glottic closure, mouthpiece obstruction, or leakage? Do the results show an obvious 1-second plateau? Was the expiration time 6 or more seconds? Or for children 10 years of age or younger, was there an expiration time of 3 or more seconds? Was expiration smooth and continuous? Was the effort maximal on expiration? We'll look at a few of these acceptability questions in more detail. First, was the start of test satisfactory? For the start of test to be satisfactory, the patient must blow out the air from total lung capacity without hesitation. This means that no more than 5% of the forced vital capacity, or 150 milliliters, whichever is greater, should be expired prior to the peak flow. What is meant by the term forced vital capacity? It means the total amount of air, measured in liters, that a patient can forcefully blow out after having breathed in as deeply as possible. Forced vital capacity is often referred to as FVC. Remember, coaching can increase FVC by as much as 10 to 15%. During the first second of expiration, the patient should not cough or close the glottis, obstruct the mouthpiece by the tongue or dentures, or allow any leaks. A patient 11 years of age or older should continue to blow out the one breath of air to residual volume for at least 6 seconds, and until there is no volume change for at least 1 second. A patient 10 years of age and younger should have an expiration time of 3 or more seconds and a 1-second plateau. What is meant by the phrase achieving a plateau in spirometry testing? A plateau is achieved when there is no change in volume for 1 or more seconds during the expiration portion of a test maneuver. Perform a minimum of 3 acceptable forced vital capacity maneuvers. At that point, assess the 3 acceptable efforts for repeatability. While not required, it is advisable to save all efforts, including those that are not acceptable, so that they are available for later review by the interpreting physician or other healthcare provider. Just as criteria have been established to determine if individual test maneuvers are acceptable, certain guidelines have been established by the ATS-ERS to help the technologist determine if a spirometry test session as a whole is repeatable. Consider the following repeatability questions after the patient has completed 3 acceptable maneuvers or trials. Is the variance between the 2 largest acceptable forced vital capacities no greater than 150 milliliters? Is the variance between the 2 largest acceptable forced expiratory volumes in 1 second no greater than 150 milliliters? According to the 2005 ATS-ERS recommendations, the 2 largest forced vital capacity values should agree within 150 milliliters. Here, you see the results of 8 trials, of which 3 are acceptable. Of those 3, the 2 highest forced vital capacities are within 150 milliliters of each other. According to the 2005 ATS-ERS recommendations, the 2 largest forced expiratory volume in 1 second values should agree within 150 milliliters. In this illustration, the 2 highest forced expiratory volumes in 1 second are within 150 milliliters of each other. What exactly is the forced expiratory volume in 1 second, or FEV1? The forced expiratory volume in 1 second is defined as being the amount of air, measured in liters, that the patient can blow out in 1 second. How do you determine when spirometry testing is completed? Each of the following questions should be considered when making that decision. Have 3 acceptable tests been performed? Has repeatability criteria been met? Have at least 8 tests been performed? Can or should the patient continue testing? Are the inspiratory flow patterns repeatable with maximal effort? Failed test performance. If acceptability and repeatability criteria aren't met after 8 attempts, the ATS-ERS recommends that you make a clinical decision to continue or discontinue testing. The maximum air expired prior to peak flow should be 5% of forced vital capacity, or 150 milliliters, the greater of the two. There should be no leaks around the mouthpiece as the patient exhales. The patient should blow out for at least 6 seconds, or 3 seconds for younger patients, and until there is no volume change for a minimum of 1 second. At least 3 acceptable forced vital capacity efforts should be obtained during the testing session. The 2 largest forced vital capacity values should agree within 150 milliliters. The 2 largest forced expiratory volume in 1 second values should agree within 150 milliliters. If acceptability and repeatability criteria aren't met after 8 attempts, determine if testing should be continued.